So the follow-up. Now you need to evaluate for the fact that you need to follow up a patient that has premature rupture of membrane. I've told you already that follow-up is divided clinically and paraclinical means of follow-up. You have the clinical and paraclinical means of follow-up. For the clinical means of follow-up, we can start by following up the disease premature rupture of membrane to find if she is wetting herself. They now find the number of liters she's wetting and all that. You evaluate for the input, the outflow of the fluid, that the balance between the input and the output of the fluid that the patient is having. Is it clear? Now, after that, so that's for premature rupture of membrane. You evaluate also for the complication of premature rupture of membrane, acute fetal distress, intrauterine frustration, and all that. You evaluate for those complications clinically and paraclinically if there's any amelioration. You evaluate for the cause if there's any leukocoria which is still present and all that clinically and paraclinically. Is it clear? So those are the elements that you evaluate in your follow-up. And don't forget that you need to take rendezvous with the patient in order to prevent that background to occur, and that background was in the case of a poor ANC which can occur, and then the patient is having polyhydramnios, a macrosomia, or a multiple gestation. Is it clear? A poorly full ANC, so she needs to be followed up for the next pregnancy. And for the cause which can be fragilization of the membrane, you need to also do a high vaginal examination and completely do the eradication of the microorganism which is causing the fragilization. Is it clear? If there is any sexual transmitted infection, all those sexually transmitted infection has to be visualized and has to be treated with the appropriate antibiotics. Is it clear? Even after doing sensitization and culture. Is it clear? So all those are the elements that you need to visualize and follow up, and you need to take the rendezvous with your patient with a good ANC in order to prevent again the next etiology from occurring, because all this is also going to affect the fetus, which is going to result to neonatal sepsis, and that's the most common cause of death in the neonate. Is it clear? Neonatal sepsis, the next most common cause of death in neonate is going to be birth asphyxia. Is it clear? So those are the different elements that you need to visualize in the case of premature rupture of membrane and preterm labor. So we say thanks for your kind attention. Please don't forget to like and subscribe for our channel SchrDbb. Thank you.